Welcome to today's webinar. County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute. This webinar is brought to you thanks to the contributions of colleagues and partners in Wisconsin and across the nation, with support from the Robert Wood Johnson Foundation. It is produced in collaboration with Healthy Places by Design, an organization that advances community-led action and proven strategies to ensure health and well-being for all. The University of Wisconsin-Madison occupies ancestral Ho-Chunk land, a place their nation has called Dejo since time immemorial. UW-Madison respects the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. This webinar will be recorded. All speakers' views are their own. Guest bios and slides from today's webinar are available on our resource page. We will share a link to the resource page when the webinar begins. Stay up to date on all things CHR&R. Find us on Facebook, Twitter, and LinkedIn. And if you haven't already, sign up for our newsletter by scanning this QR code with your phone's camera. It's the best way to find out about upcoming webinars, our podcast, and our latest tools and resources. Your facilitators today include our host, Erica Burrows-Girardi, with support from CHR&R Communications Specialist, Colleen Wick, and the Collaborative Learning Director from Healthy Places by Design, Joanne Lee. We invite you to continue the conversation immediately after the webinar in our discussion group. Joanne Lee will be our lead facilitator. And watch for a chat from Colleen for details on how to join the group after the webinar.
Welcome to Non-partisan Strategies to Advance Health Policy. Hi, my name is Erica Burrows-Girardi. Have you been challenged with advocating for policies that support equity, all the while trying not to avoid the politics and the partisanship that seems to accompany it? Well, this webinar is going to be helpful to any of you working in that space, that if you're working toward equitable policies, but have found politics to sometimes creep in and be a barrier. As you participate in today's webinar, I want you to think about the importance of policy and what that means for sustainable, equitable change. You have a role to play in policy. I have a role to play in policy. And here at CHR&R, we believe that in a democracy, everyone has a voice um, in deciding how our society is structured. An inclusive democracy creates opportunities for every person to participate actively in shaping the conditions that affect our lives. And as we build a world where everyone belongs, we ensure everyone has equal voice in deciding how systems and institutions function. So as you think about that, I want to introduce you to others who are going to be joining in your learning experience today. And I'm going to start with Joanne Lee with Healthy Places by Design. Hi, Joanne.
Hi, Erica. So good to be with you again this month. And hello to everyone in our audience. Thankful that you're here sharing time. So my role during this live webinar today will be to monitor the Q&A box. So you can go ahead and open the Q&A box. And this is where you will want to put questions for our guest presenters. So I will be keeping track of the questions that come in. We'll be answering as many as we can in the box, so watch for answers there. But we'll also be queuing up some common questions to answer live during the Q&A portion of today's webinar. Don't worry, if we're not able to get to all of the questions during this live webinar, we have the post-webinar discussion group to also address some of your questions. And you'll learn more about the discussion group later on in the session. But right now, I want to turn it over to Colleen Wick, who will be talking about how you can use the chat box to engage with us. Colleen?
Hi, everyone. Thanks, Joanne. As Joanne said, I'll meet you in the chat. Use the chat to share remarks or respond to any questions we may ask you. Our chat conversations tend to be very engaging. So if you are too distracted, you could just close the chat window. If you have any questions for the panelists, use the Q&A box, just as Joanne described. And now I'd like to pass it on to our technologist, James Lloyd.
Thank you, Colleen. Yeah, I'll be the technologist today, providing technical support. And if anybody has difficulty, please also use the Q&A pod to say that you can't see slides, and we'll do our best to make sure that you can have an enjoyable webinar. Again, Erica, I'm so excited about this topic. So thanks for having me here, and turn it back to you.
Thanks, James.
Yep.
We can't do these webinars without you and Aaron. Our technologists are always so helpful to us. But thanks to the entire production team for helping us with this webinar today. And this gentleman probably looks familiar to you if you are involved in public health. Yes, that's Dr. Georges Benjamin. He's the executive director of the American Public Health Association, and he was our guest last year at this time. And when he was here, he said, we work in a political environment and we have to become much more comfortable with that. So, we can't avoid politics no matter how much we try. 'Cause the reality is that policymakers, no matter what side of the aisle they represent, are better prepared to write and enact policy when they are informed. So, our job is to educate and inform while removing the partisanship from all of that. Now, I'm not saying it's easy. Many of you have shared data and strategies with elected officials and still struggle to get policy passed. I know you share it with us. So I want you to know that we hear you, we hear your frustration, and we understand. And that's why we're fortunate to have two policy experts, both with law backgrounds, from a national organization called ChangeLab Solutions. And they're joining us here today to help us address these three primary questions. What is preemption and how can we manage it? How can I develop policies that are equitable, also enforceable? And what are effective nonpartisan strategies to advance policy? So this is really going to be a good webinar, just like James said. So you definitely want to plan to join our discussion group, which is going to follow the webinar, because this is a place to really unpack what you're going to hear today. Now, during the video intro, you heard about our discussion groups that always follow our webinars, and they're facilitated by our friend Joanne, and they're always engaging. They give you the chance to share with others and also learn from others. So be on the lookout for the link that Colleen's going to chat out at the end of the webinar. It'll have all the information you need to join us. And I want to let you know that our guests from ChangeLab Solutions will also be a part of our discussion group. And with that, I want to let you know who they are. Sabrina Adler is Vice President of Law at ChangeLab Solutions, working primarily on legal and policy issues related to preemption and good governance, the commercial determinants of health, and healthy children and families. So, Sabrina, thank you so much for joining us.
Thank you for having me.
And I will be circling back to a conversation with you in just a second, but I want to introduce your colleague. Her name is Katie Michel. Katie is a senior attorney working in multiple program areas to support sustainable communities, focusing on food systems, environmental health, and justice. Katie, how are you? And thank you for joining us.
I'm good, Erica. Thank you. It's great to be here.
And so I encourage you all to read more about our guests by visiting the resource page that Colleen has already chatted out, but she can chat that out to you again. And just before we hear from Sabrina, I want you to hear this from me first, because some of you may have to leave the webinar early. I want you to know that the 2023 rankings are coming, folks. Join us on March 14th to find out what you can expect from this year's 2023 release. We'll be answering questions in that webinar like, what is the focus of the 2023 release? What new measures can you expect to help you improve health? What new strategies will be available for you to consider? And the question that I know you all are asking, when will the release of the 2023 rankings drop? So we're going to answer all of these questions and more on March 14th. And we're going to be joined by my colleagues from various project teams to get you ready. And you can actually register for that webinar today. I'm going to revisit this announcement at the end of the webinar. For now, I want to move on. I just wanted to make sure that I got that out there for those of you who may have to leave. Hopefully none of you will leave, but you never know. So with that, Sabrina, please come back to the mic. I'm so glad you're here. ChangeLab Solutions is one of County Health Rankings and Roadmaps hero organizations. We really, really love the work you do and so happy that you're in this space. But for those who may not be as familiar with ChangeLab Solutions, can you share with us what it is that you do? Like, who are you and what do you do?
Sure. Thanks, Erica. I'll also just say I have a little bit of a cold, so I'm going to try and make it through without too much water drinking or sniffling, but apologies in advance if that happens.
Sure.
So to answer your question, ChangeLab Solutions is a nonpartisan nonprofit organization. We use the tools of law and policy to advance health equity. So we believe that achieving health equity requires addressing structural barriers to health, which we call the fundamental drivers of health inequity. And those drivers are structural discrimination and racism, income inequality and poverty, disparities in opportunity, disparities in political power, and governance that limits meaningful participation. So Katie and I, who are here today, are both attorneys, but we have an interdisciplinary team. We also work with policy experts, planners, and more. And we work with community organizations, governments, and local institutions all around the country to design and implement equitable, practical policy solutions to complex health challenges. We leverage the strengths and knowledge really of the communities that we partner with to bring about change in local and state policy systems and environments. So that's all. It's a lot of words, but how do we actually do those things in various different ways? So for example, we offer trainings and individual guidance on the policy making process. We create peer learning groups sometimes to share information, and we develop practical policy tools, things like memos and toolkits and fact sheets. You can find them all on our website, or at least most of them, that translate complex policy and legal concepts into actionable solutions. And in terms of what we work on, so we work on health issues in cross-cutting areas like planning and housing, food systems, investment and family supportive services, and a wide array of things. And we prioritize work in the spaces that we do because we believe that there are certain systems that really have the greatest potential to affect the health of people and communities.
Yeah, and just thank you for everything that you do. ChangeLab obviously has a lot of resources. Some of those resources are going to be on your resource guide that you're going to get tomorrow in your inbox. And then I know that Sabrina and Katie are going to be sharing some contact information with you later on in the webinar so you can get more information about the work that they do. But you can see it's extensive. And so we are so grateful you are here. And I know I shared with you, Sabrina, that one of the unfortunate challenges we hear from communities is that even when they have successfully advocated for an equity-centered policy and it was passed and everything, it sometimes gets negated by preemption. What's preemption?
Yeah, so we hear that too. We'll talk about it more. At its core, preemption is referring to when the law of a higher level jurisdiction limits or even eliminates the power of a lower level of government to regulate a certain issue. So that can be the federal government with respect to states or I should say localities, but it can also be the state government with respect to local, as you can see in the illustration on this slide. So I also want to note that preemption is separate but really related to the concept of local authority more broadly. So if you look at our governance structure in our country, the amount of autonomy and authority of local governments really varies from state to state, and it depends on what the state constitution says. But even in states where local governments in general have a lot of autonomy and authority, the state legislature still in those places can sometimes remove localities' power to act on specific issues or across a range of issues. And that's true even when the state itself is doing nothing to act on those issues and creates what we call a regulatory vacuum, just sort of leaving a space totally unregulated.
Yeah, and my next question is like, how can it happen if policymakers are being responsive to their constituents? I don't get it.
Yeah, so to go through sort of a trajectory here, but I know it's foundational to the county health rankings work that where you live is often a better predictor of your health than your genetic code. And so we all know, I think, on this webinar that where people live has a substantial effect on disparities in health, wealth, and life expectancy, and that those differences can exist even between neighborhoods that are just a few miles apart. And we also know that those things did not happen by accident. So there have been decades of federal, state, and local laws that have played a significant role in establishing and perpetuating discriminatory systems and institutions that influence where investment and opportunity are concentrated and who has access to those things. And the result of that is significant inequities in the distribution of things like housing, education, environmental quality, financial stability, all the things that we talk about as being the social determinants of health. And those inequities have really profound effects on underserved populations, including increased risk of chronic disease, higher infant mortality rates, and lower overall life expectancy, among other things.
Hmm.
So tying all of that context back to preemption, then we look at when communities have tried to do something to remedy those inequities, and many find that due to preemption, their zip code and their location dictates their ability to pursue more equitable laws through local government action. So some state legislatures around the country are using preemption in an increasingly dramatic and brazen way to remove local authority to regulate not just in public health, but in a lot of areas affecting health. And those efforts we're finding are often motivated by ideological and practical opposition to specific policies or general push towards deregulation rather than a real need for uniform statewide regulation. And a lot of the new preemptive laws are based on model legislation crafted by something called the American Legislative Exchange Council, or ALEC, and it's an organization whose members include corporations and state lawmakers. So preemption is not new in the world of public health, but this recent wave that we're seeing is categorically different from what we've dealt with historically. It's more extreme, it's wider spread, sometimes it's punitive in nature, and it's often undermining the power of BIPOC communities specifically.
Hmm. And for those of you in our audience, if what Sabrina is sharing is sounding familiar, I would love to hear what you're seeing. If you've experienced something like this locally, share with us in the chat. And I'm going to ask Sabrina to kind of share some examples of how this undermining is happening across the United States.
Sure. So I'll give a couple of examples, and there are many I could have chosen from here, but this first one in 2016 in Birmingham, Alabama, where nearly 75% of the population is Black, they enacted a minimum wage ordinance intended to address economic inequities. And as is true in many places, Black low-wage workers in Birmingham make only about 80 cents for each dollar earned by white low-wage workers. So that's the context in which we're working here. And what happened was almost immediately the Alabama state legislature turned around and prohibited all localities across the state, including Birmingham, but every other locality as well, from regulating not just wages, but also benefits, work schedules, and a variety of employment-related issues. And they did this without enacting a state level minimum wage or any state level standards in any of these areas. There wasn't a single Black legislator that supported this preemptive state law. Many characterized this action on the state level as another example of lawmakers manipulating the political and legal process to disenfranchise communities of color. And there was a lawsuit that challenged this law, partially on the grounds that it was discriminatory, and that made its way through the courts, but ultimately the law was upheld.
Wow.
So another example here in my home state of California, the state that has passed more local sugary drink taxes than any other state, we saw these taxes preempted after what the press and many others actually referred to as blackmail of the state legislature.
Yeah, I actually remember this story because I kind of remember when that was passed. I shared the example with other community partnerships.
Yeah, so this got a lot of attention, probably
Hmm.
probably rightly so for those that are sort of in this space. But this was 2018, and the beverage industry, along with a number of other industries, qualified a measure for the November 2018 ballot that would have made it really difficult for local governments in California to raise revenues like at all. And it could have had really devastating consequences for cities in California. So a few days before the deadline to remove measures from the ballot, the beverage industry agreed to take that potentially crippling measure off in exchange for the legislature enacting a bill that would preempt local sugary drink taxes from being enacted in California or being changed, because there's a few existing ones, until 2031. Uh, at the time, there were several cities in California that had been gearing up to enact taxes in order to combat the inequitable health outcomes of sugary drink consumption and the targeted marketing of sugary drinks to low-income communities of color. In particular, there was a group of youth from Stockton who'd been working for years, really, to lay the groundwork for policy and a tax there. And they went to Sacramento, they talked to the legislators, but the legislators really felt like their hands were tied. A lot were really like vocally infuriated by what was happening. They felt like they had no choice but to vote for this, and they reluctantly did. So it passed, but it was pretty clear that they were angry about it, and the press picked up on that as well. So this is a pretty egregious example of preemption playing out in a state that is pretty liberal and progressive when it comes to public health policy and also when it comes to local government authority. But even here, it
Yeah, I
happened.
mean, it's just kind of showing you how, just like you were saying, it's become somewhat pervasive now, and it's even made its way. This preemption tactic has impacted health equity in the context of COVID-19, the pandemic. So,
Yeah.
can you share how we saw preemption show up even here?
Sure. So it played out in a couple of different ways. First, there were cities and states that preempted things like local paid sick leave or municipal broadband, and those cities were already starting from behind when the pandemic hit in early 2020. So residents in those places didn't have access to some policies that were critical for ensuring equity in the face of a pandemic. And that pre-existing preemption also stifled the ability of some cities to rapidly respond by enacting things like emergency paid sick leave or eviction or foreclosure moratoria or a number of other things. Then, as governments began to respond to the pandemic, we also saw new preemption being put into place. Some of it was related directly to infection control, so preempting local mask mandates, preempting local social distancing measures, or local vaccine mandates. Um, and other similar types of policies.
Yeah.
Then in some places, we saw states go even further to actually punish localities that weren't compliant. So if you were following the news, you might have heard about this. Georgia Governor Kemp actually sued the mayor of Atlanta, Keisha Lance Bottoms, when she enacted a mandatory masking rule in the city, and it ended up preventing the rule from going into effect. In other states, we saw the state use threats of withholding funding to coerce localities in various ways. So in Nebraska, the governor warned local governments that they wouldn't receive federal COVID funds if they imposed masking or other local rules. So that's a lot of examples, but as you can see, there's a lot going on in this space.
Yeah, so we should talk about, is preemption always, negative, or is there a time when it's actually a good thing?
Yeah, thank you for asking that question. It's important to point out that preemption in and of itself is not inherently good or bad. It's not inherently adversarial to public health or equity or even good governance. So if you think about the Civil Rights Act of 1964 or the Voting Rights Act of 1965 or the Fair Housing Act, all of these landmark federal civil rights laws have been critical for advancing civil rights, and all three do so, at least in part, by preempting state and local authority insofar as they serve as a floor. So it's important to remember that it was the long history of discriminatory state and local laws that led to these federal laws being enacted in the first place. And even today, we know that states and localities do continue to perpetuate and sometimes exacerbate racial inequities and other injustices. And we also know that some preemptive laws, even if they remove local authority entirely, can be protective in nature and can advance equity. So given that context, I think there are two things that are clear. One, I do want to just emphasize again that the majority of preemption that's occurring today is likely to harm public health and lead to inequitable outcomes. That's just the reality of the political context. But we also know from history that local control can be problematic. It's important for states and the federal government to have the ability to preempt local actions that are likely to be harmful. So the first thing we always need to do is figure out with any given instance of preemption, if it's going to be harmful or if it might actually promote equity. And in a second, I'll talk about a resource we have to help figure that out.
Yeah, let's talk about that because I mean, the bottom line is that we want people to have equitable opportunities to be healthy. So how do we stop preemption when it becomes harmful?
Yeah, so I'll walk through a couple of different ways. I think the first thing that we talk about is through advocacy and organizing. So even before any legislative or political work, it's important to lay the groundwork, build coalitions, develop messaging. There's an organization called the Local Solutions Support Center that has a lot of resources on this and has done a great job organizing folks across issues. That's been a big part of the preemption grassroots work, is this cross-issue organizing. So you check out LSSC if you're interested in this work. Next and related, we have working through the political process. That can include enacting legislation that affirmatively guarantees localities the authority to act or explicitly says it's not preemptive, but it can also include passing preemption laws that advance equity or repealing existing problematic preemption laws. Another tactic is litigation. So sometimes preemption laws are vulnerable because they have constitutional infirmities or they were passed in a way that doesn't comply with laws governing legislative procedures. For example, at ChangeLab Solutions, we've been working to support a lawsuit that's challenging the California sugar drink tax preemption law that I mentioned, because we did some research that revealed that there are potential violations of the California Constitution. So I can talk more about that lawsuit. I could do a whole other webinar about that lawsuit, but I can talk more about that in the Q&A if people are interested.
And a discussion group.
Yeah, exactly. So just two more quick things. We have structural reforms. So that's referring to that idea that we can strengthen what we call home rule authority in states. So it just makes it harder to pass preemptive laws in the first place. That's a longer term effort. National League of Cities is involved in that. And then finally, just want to point out that it's important to have research in this space to really understand the effects of preemption. I think it's easy to just assume that it's bad or good, but to get some of that data, and we've been working a little bit on that with LSSC and others, can help with messaging and also with policy making and litigation.
Yeah, thank you for following it so we'll know. Now, we do know that there are some success stories out there, and you're actually sharing a couple with us here on the webinar. And folks, you can get more details about these success stories in your resource guide. So Sabrina, tell us about these success stories.
Sure. So I mentioned Local Solutions Support Center. Also, the American Heart Association has been working on this issue, doing a lot of on-the-ground work. And so in Maryland, there was a lot of preemption popping up across a bunch of different issues. So instead of fighting them piecemeal, various groups joined together to form that type of cross-sector coalition I mentioned a second ago. It was called Local Maryland. It was more than 25 advocacy groups, and they successfully fought back against a move to insert preemption into a Maryland minimum wage bill a few years ago. So the bill itself passed. They set a minimum wage in Maryland, but there was no preemption of higher local minimum wages. Similarly, in Colorado, there had been minimum wage preemption on the books since 1999, and there was another coalition that started in 2017 to work to repeal that law. First, they worked to raise the state level minimum wage through a ballot initiative, and then in 2019, they successfully repealed the preemption so localities could enact higher minimum wages. Denver ended up actually doing that. In Colorado, they are also working on repealing a tobacco control preemption law in 2019, so that was a success. Again, hope that the lawsuit in California will be a success, but stay tuned on that.
Right. My fingers are crossed with you. So thanks for sharing that. I don't want folks to think it's all doom and gloom. We do have success stories out there, and you all may have some success stories as well. Feel free to share it in the chat. Feel free to come to the discussion group. Tell us about your success stories locally. So I know, Sabrina, ChangeLab has a wealth of resources. I actually get lost on your website a lot of times because there's so much on there, but we can't talk because our website is the same. But so can you just share a few of the resources that you brought and that's going to be on the resource guide too?
Yes. So there, I know this, what's on the slide is not easy to link because it's just a lot of words, but yes, this is all in the resource guide. We have a whole variety of resources on preemption. Some of them, there's little like snapshots of here, but we have others as well. So some fact sheets that go over some basic information about preemption and its mechanics, how it affects health equity. I mentioned figuring out this sort of equity analysis. So we have a toolkit to help policymakers and advocates understand how preemption affects local public health policy campaigns. So there's lists of questions to really walk you through that equity analysis, and then also has very practical guidance on who to reach out to, what questions to ask during this policy work, how to respond to threatened, proposed, or already enacted state preemption that might affect the work that you're doing. So I encourage you to check out this whole, we call them collections on preemption, see what's there.
Thank you so much, Sabrina. Take a break, get some water. You got through, which is
Thank you.
one little cough. But thank you so much. And we're going to circle back to you with questions in a bit. But now I want to bring Katie Michel back to the mic. Katie, again, thank you for joining your colleague today to talk about all the good work that ChangeLab is doing. I want to start by asking a question about what is equitable enforcement, because it was a new term for me. So can you describe what that is? Oops, you're on mute. Get Katie to come off mute and answer these questions. Oh, she might be frozen. Sometimes that happens. Sabrina might be able to go ahead and answer those questions until Katie.
Yeah, it does look like she's frozen. Am I also frozen? No,
you're not.
I'm happy to step in until I can talk a little bit about this until she's able to unfreeze herself. So when we're talking about equitable enforcement, we're talking about the process of ensuring compliance with laws or policies that considers and really minimizes harms to underserved communities. So that equitable enforcement approach means considering equity on two levels. First, on the level of the enforcement strategy broadly, and then also at the level of how that strategy is carried out in any given individual enforcement action. It also means considering equity at all stages of enforcement, from determining when to undertake an enforcement action and against whom, to deciding which enforcement tools to use.
Okay, and I know Katie has left. She's probably going to come back.
Yeah.
But can you shed a little bit more information until she does come back? Sorry you didn't get a water break.
No. Also back. Yeah, so when we talk about inequitable enforcement, we're usually looking at two different sort of broad concepts. The first is under enforcement, and the second is over enforcement. When we're talking about under enforcement, we're talking about what happens when laws that are designed to protect communities are not consistently enforced. And that often is happening in already marginalized communities. So just one example, local housing codes are laws that are designed to protect public health by ensuring safe and habitable housing. But those laws are often under-enforced, largely because they tend to work in a complaint-based system, meaning a tenant has to complain about a problem to a housing agency in order for there to be an inspection or any enforcement against the owner or landlord. And often there are barriers to making those complaints: language barriers, lack of education about rights, lack of knowledge of the law, fear of retaliation is a big one, displacement, eviction, etc. So in response, one tactic we've seen a lot of jurisdictions use is to adopt proactive rental inspection ordinances, which require inspections of rental units on a routine basis, regardless of whether there's a complaint. And so that's shifting responsibility from individual tenants to the government actors to actually ensure compliance with housing codes to deal with some of those challenges.
Yeah, that's awesome.
So the flip side of that is over enforcement, and that occurs when laws are enforced more frequently or more strictly in certain places or against certain people as compared to others. So there's data that suggests that over enforcement can adversely impact health and compound existing health inequities by exposing the person against whom laws are being enforced to greater harm than what the law is actually trying to protect against. So the balance doesn't work out. Out in terms of what the law is Chief.
And can you share some examples? I know Katie was going to share some examples of how this plays out.
Yeah. So it can play out in a lot of different ways. First, it can mean that the strict enforcement of laws, it can mean strict enforcement of laws even when there's not really furthering a public health goal. So, for example, we can think about zero tolerance policies in schools that result in widespread and inequitable suspension and expulsion, even for relatively minor offenses. There's been a lot of attention over the last few years about the negative impact of exclusionary school discipline policies like these on student health and on long-term outcomes. So as a response here, and a solution we've seen is districts exploring restorative justice practices that foster feelings of belonging, social engagement, meaningful accountability instead of just punishment. And there's evidence that these initiatives and these responses have decreased racial disparities in suspension rates, reduced school violence, and improved relationships between students and staff. Another example, so over-enforcement can sometimes mean that laws are directed at individuals instead of the systems and actors that actually have the power to do things to make meaningful change. So one example we talk about a lot, youth purchase, use, and possession of tobacco products. When you're punishing the individual, the youth that is purchasing, you're ignoring the role that the industry, big tobacco plays in this. So industry and retailers intentionally targeted youth to create a new generation of consumers. And then if you're talking about enforcement here, I think targeting the corporate actors such as tobacco retailer licensing and restrictions on flavored tobacco products can be more effective and just than those enforcement actions that punish the behavior of those youth who use the tobacco products, which are by design deadly and addictive.
And I understand that Katie is back. Welcome back, Katie. And thank you, Sabrina. Sabrina didn't miss a beat.
No worries.
Katie, I want to ask you, why is it important to consider enforcement in public health law and policy? Why is this, really, really critical here?
Yeah, thank you so much. Sorry for the technological
Hey,
difficulties. And thank you, Sabrina, for jumping in. So when we think about traditional public health laws, enforcement often feels like a bit of an afterthought. We spend a lot of time and energy identifying problems and solutions, drafting and designing policies, and engaging in campaigns to enact policies. But too often we see the passage and enactment of a particular policy as the win and the endpoint of the process. But as the examples Sabrina was just pointing out show, even a seemingly good or well-designed law can be ineffective or even worse, detrimental without equitable enforcement. The law is a critical tool to solve problems in our communities, to keep people safe and healthy, and to help people reach their fullest potential. But because of our history of discrimination in laws, policies, and practices, best intentions aren't enough. We also need enforcement practices that can hold wrongdoers accountable, while also ensuring that the intended benefits of laws that are designed to protect people's health and safety are actually realized. Before moving on, I just also want to point out that police are often tasked with enforcing public health laws, and at the same time, over the last couple of decades, we've really seen the definition of public health evolve as we gain a deeper understanding of the systemic drivers of poor health and health inequities. I raise this because I think it's really important to understand how interconnected policing and public health are. And that's true even when police are enforcing laws outside the traditional parameters of public health. In the wake of tragic high-profile incidents of police brutality and violence, most recently the death of Tyre Nichols in Memphis, there's been growing attention to delineating the appropriate role of law enforcement. So for example, many criminal justice advocates argue that police, who typically lack adequate training in mental health, substance use disorders and other non-criminal social problems should be replaced by professionals with relevant expertise to respond more effectively and to reduce those opportunities for racial injustice. So I think there's been some increased attention to enforcement of public health laws in that respect, but it has mostly happened within the larger context of police reform. And this is just another reason why it's important for public health practitioners to begin thinking about those interconnections between enforcement and health, and to build alliances across sectors, disciplines, and causes to pursue more equitable enforcement.
And then, so what are some of the examples of public health enforcement that could be considered, like best practices from a health equity perspective?
Yeah, thanks for asking. I think Sabrina probably mentioned a couple earlier, like proactive rental inspection and restorative justice practices in schools, but I'm happy to highlight a few more. So building on the interconnections between policing and public health that we just discussed, the city of Berkeley has really led the charge to move traffic enforcement out of the police department with the goal of reducing the risk of racial profiling and violent encounters with the police. So while Berkeley has run into some conflicts with the statewide vehicle code, so connected back to the preemption issues Sabrina was discussing, the city's organizing efforts have really helped to shine a spotlight on this issue of traffic enforcement and have sparked similar movements in other cities throughout the country, from Portland to Minneapolis, and even a statewide bill in Florida. A related approach, which other communities are pursuing, is committing to Vision Zero strategies that prioritize safer streets and safer roads to avoid the need for traffic enforcement in the first place. So just another example that could be considered a best practice comes from the state of Colorado, which recently adopted one of the most robust statewide paid leave laws in the country. Under Colorado's Healthy Families and Workplace Act, all employers of any size are required to provide paid leave for various health and safety related needs. And enforcement provisions allow for employees to collect damages in the form of lost wages and attorney's fees, reinstatement if the employer's violation costs the employee a job or assignment, and then fines or fees imposed against non-compliant employers. So in that list of enforcement tools, I really want to highlight attorney's fees. Free and low-cost legal assistance is in very short supply, and authorizing attorney's fees provides an incentive to the private bar to take those cases and allows more workers to pursue meritorious claims. So just one last thing before I move on, as we're talking about best practices like these, I really want to put a plug in for including evaluation provisions when adopting innovative policies and trying out new enforcement approaches. It's really hard to know whether a policy or an enforcement strategy is working or not if we don't have the data to prove efficacy. And without that efficacy data, it's really hard to push for investment in innovative laws and policies and spur their diffusion across the country.
Such a good point. We need to know that it works. And so while it's good to for you to know intuitively it's working, anecdotally it's working, find a way to really evaluate. And I know ChangeLab can help you create an evaluation plan so you can evaluate things like that. I want to ask, how can practitioners start putting these equitable enforcement concepts into practice?
Yeah, so I encourage folks to check out our website where you can access a suite of resources on equitable enforcement that are designed to help policymakers and others put these ideas into practice. And just to highlight two, our equitable enforcement guide poses a series of questions that policymakers can consider when drafting, implementing, and enforcing a policy. And then we recently launched an infographic and fact sheet that profiles key players and their roles in the equitable enforcement ecosystem. Also just wanted to quickly mention that we have a webinar coming up next week on fair labor practices and equitable enforcement, I think Colleen just dropped a link to register in the chat if that's something that would interest you. And then finally, just want to stress that all of our resources on equitable enforcement are really about the process of intentional community-specific policymaking. So what works well in one community might not work well in another. And also, no specific type of sanction is inherently bad. It's all about the context and the application, similar to what Sabrina was mentioning with respect to preemption being neither good nor bad. It's just a legal concept. So to sum up, we just really want to return to the idea and the central concept of enforcement as a means to promote compliance with a policy to achieve its intended goals. And how you get there can look really different depending on the context.
So true. And these are also tools that's going to be included in your resource guide. And people ask the questions like, well, how can I, inform my policymaker without making it sound like I'm lobbying for a bill or legislation? Well, this is it. This is a toolkit has been designed for policymakers and practitioners to actually understand the nuts and bolts of equitable enforcement. So this is a way that you can educate your elected officials and decision makers about how to choose policy that's effective and enforceable, but also keeping the partisanship out of it. So thank you so much, Katie. Tell us the different ways that folks can reach out to you all. So thank you so much. Folks, if you have any questions for either Sabrina or Katie, do make sure that they're in the Q&A box because we're getting ready to go to that in just a second. But James now is launching a poll because we are always curious, this, we're always curious about whether or not the strategies that we're sharing with you in the webinar are strategies you think you can use. So just answer this. It's anonymous. We don't know what your answer is and who it's tied to, but we are curious about whether or not we are presenting strategies that you think might work. So those strategies related to how to deal with preemption and how to craft policies that are equitable, that have equitable enforcement. And then share with us in the chat any challenges you think you might encounter in trying to employ those strategies. And James, you can go ahead and close that poll in 5, 4, 3, 2, 1. So thank you so much for your response. All right, Joanne, I bet we've had like tons of questions. I know the chat has been like super busy.
Yes,
So tell us what's going on.
I've actually been picking in the chat because folks have been great about your call to share their own experiences with preemption and equitable enforcement. So all of those folks need to come to the discussion group to share. But we do have some really thoughtful questions. Thank you so much, Sabrina and Katie, because you've really got folks thinking and really importantly, seeing how the information you shared relates to their own context in their own communities. So I'm just going to start with a question from Jennifer. And Sabrina, she was really reflecting on the fact that she thought it seemed a little odd that folks at the state or federal level could preempt after the fact. And she wondered, wouldn't the local law be legacied in as long as it wasn't against an existing law?
That's a good question. It depends. Oh, can you hear me? I froze for a second.
Yes.
Yeah, that's a good question. It depends on the preemptive law. It may depend a little bit on state law, but in general, you could legacy or grandfather, we often call it, in existing laws, like the California law preempting local sugary drink taxes says that existing taxes could remain in place, but they can't be changed in any way. So that can be a challenge, but that's not true of all preemptive laws in essence, because in states, locality is often sort of their authority is not inherent. It exists because the state has granted them authority. The state also can take it away, and that can happen, like in the Birmingham case, even after the fact. Now, there can be legal challenges. Sometimes that can't. There are state constitutional provisions that make either like I said, the way that is done or specific elements of it problematic, but often the legislatures go through and then it's up to the courts to decide whether that was the case. So
Okay.
it's a little counterintuitive, but yes, the unfortunate answer is that can be taken away. It's a little different from federal to state because states do have more inherent authority under the federal constitution, but we could go down a whole rabbit hole.
Yeah.
But
Yeah.
in general, yes, it can happen after the fact.
Great. Thanks for walking us through that. The next question is from Harold, and you mentioned ALEC, and he wondered, is there a group to counter to ALEC, and what are they doing to advocate for health equity?
Yeah, so the short answer is not really on the same level. There's a group called State Innovation Exchange, or SIX, that does some of this work. There have been some groups that sort of work to support local governments, but none of them really have been able to match ALEC in terms of influence and funds, really, when it comes to it. I know there's some conversations happening now about developing more of an infrastructure for advocacy on the public health side, so beyond just preemption, but it's hard because they have so much corporate backing that it's just hard to compete.
Unfortunate with that amount of financial backing.
Yeah.
All right. I think, I'm not sure if it was Sabrina or Katie that talked about state laws being the floor for stronger local policy. And Chelsea wanted to just hear a little bit more about that. And Chelsea was thinking especially about what's happening with flavored tobacco in California.
Yeah, so I'm not an expert in the flavored tobacco world. Katie may know what's going on more with that, and I know there's federal action on flavored tobacco too, but more generally speaking, states can set law or can enact laws that act as a floor, meaning minimum wage is sort of the example we use most typically to make it very clear, like to illustrate this very clearly. So there's a federal minimum wage. States can preempt local minimum wages, and they can do that while setting their own minimum wage, or they can do that without doing anything. So the setting their own minimum wage, they would be a ceiling if they're preempting localities, or doing nothing would be what we call creating a vacuum. They can also set a minimum wage and not have any preemption, or have what we call floor preemption, which means that localities can't set anything below what the state has set, but they could set a higher minimum wage. So say they set a $20 an hour, let's be optimistic, $20 an hour minimum wage. A locality could not set, an $18 an hour minimum wage, but they could set a $22 or $24 an hour minimum wage. And that applies across a whole number of different types of policies. So in general, that type of floor preemption from an equity perspective tends to be a good thing, whereas the vacuum, the ceiling, we can argue around whether it's it sets a standard at least, and it makes everyone puts everyone in an equal standing, but prevents localities from doing more. The vacuum tends to be, though, again, it can be nuanced, universally more problematic, with exceptions, always with exceptions.
Yeah, you all have such a great way of helping lay people like myself understand legal terms and the whole process. So thank you for walking through that. It was very easy to follow. All right. Well, we know that ChangeLab Solutions is a wealth of resources and information, not only on these two topics that we've covered today, but Leslie wanted to know maybe if you had more resources or ways to get community organizations to understand that they really need to be advocates on state and local levels when it comes to equitable policy. Is there a place in your resources or some other organizations you might point to for community organizations and advocacy?
Yeah, I can start, and Kate, I feel like I'm talking loud. Katie can jump in if she has other stuff too. I mean, I think everything we do is sort of in support of that ultimate goal. So what I may be hearing the flavor of in this question is this reluctance to work on advocacy activities. And so to that end, I do want to point out that we do have, like, unrelated but also highly related to the topics we're talking about today, some resources on our website about the difference between advocacy and lobbying, and all the various ways that organizations and individuals can engage in advocacy work without sort of crossing that line that sometimes can pose a problem for, depending on where your funding comes from and who you're working for, into lobbying. So I can if I can Google fast enough and stop talking for a second, drop some links into the chat, or you can just Google ChangeLab Solutions Advocacy and Lobbying, and it'll probably pop up. We have a webinar. There's some resources that we've shared. But Katie, I don't know if there's anything else you want to say to that end.
I was just going to say our blueprint for change makers is also just a sort of fundamental resource in our work and is a good grounding on the connections between equity and public health, and then also how law and policy fit in and play a role in both producing inequities and remedying inequities.
Great. Great. And Katie, while I have you, this questioner said, how can equity-minded public health staff advocate for equitable enforcement when it comes to their own public health enforcement of standards that are state-driven, such as environmental health and or local, such as quality of life ordinances?
Yeah, that's a really good question. And again, I think it depends on the context and really what is included in the state laws that you're enforcing and what sort of limits around enforcement are in the state laws. I think often state laws may establish like what the specific consequences are for violating a law. So like setting the fines and fees, if those are included in the laws, or even like just a process for how you enforce. But I think one thing I would lift up is that when we think about an equitable enforcement approach, it can really begin early on. So like long before you get to the point where you need to be enforcing in the first place. It can really start with public education and outreach so that people know what the legal requirements are, making sure that information about laws is accessible in many languages, in many formats. And then I think that's one place where people in local enforcing agency have some flexibility to work within the law to promote equity.
Great, thank you so much. So I think we got through most of the questions, but folks, I know a few questions are still coming in, and make sure if you can join us for the discussion group, we can pick up those questions. But Eric, I do want to mention that Kenny asked, he said, you know, for those who might be new to the equity arena, where can they get educated on equity so that they can be more effective as community advocates? And I know that the CHRNR website has wonderful tools around equity and how to advocate in different arenas. And the action learning guides, I think Kenny would be a great place to start.
Yeah, we have a suite of action learning guides. They'd be awesome. They're linked on our resource guide too.
Perfect. So I will turn it back to you, Erica, because I know it's about time to close the webinar and start the discussion group.
It is. And I know that Colleen is chatting out a link to our survey. So folks, please complete the survey. Listen, this is how we know what's important to you. This is how we know what's on top of your mind. This is how we know the challenges that you're dealing with. So let us know how we did, how we hit the mark. We listened to all of your feedback, believe me, and that's how we fine tune our content. So thank you so much for filling that out for us. Now, I do want to mention this again, because the 2023 rankings are coming and you need to be prepared for that. So join us on March 14th to find out what you can expect with this year's release. And so again, the questions we're going to be answering is like, what will our focus be this year? What new measures you can expect that's going to help you improve health? What new evidence strategies will be available for you to consider? And again, that question everybody always asks us is like, when is the rankings going to drop? We're going to answer all of that for you on March 14th. So I'm going to be joined by my colleagues. Colleen, that you always see here at our webinars, will also be joining us to talk about what's going to happen with our podcast around rankings time. We'll also be joined by two colleagues that you may have haven't met before. Molly Burdine, a data analyst from our data analytics team, and Ben Case, an evidence analyst from our evidence policy and analysis team. So I will see you on March 14th. Again, you can register for that webinar as early as today. Now, don't forget about our discussion groups. Colleen, please go ahead and chat that out now. I took a peek into the chat box and I saw people were asking about the discussion group. So I'm hoping to see you there in a few minutes. Joanne's getting ready to leave. I know Sabrina and Katie are going. And so they're getting ready to leave and hop off and join us. And so I want you to join us as well. And lastly, be sure to stay in touch with us through social media and subscribing to our newsletter. I want to thank Sabrina Adler and Katie Michel for sharing their wisdom with us. And I will see you in the discussion group, and I look forward to seeing you next month. Thank you for everything that you do to create equity in your communities. Have a good afternoon.